Hi, my name is John Gibbons, and today we're going to look at treatment of a shoulder using active release techniques and soft tissue release. Ideally we need some form of wax or cream or oil, and this is a massage type of cream that's formed into a sort of like a wax. We can apply that on the posterior part of the shoulder, so we don't need much, just a small amount on that part of the shoulder. And then what we're going to do is anatomically find where we are. So this is the spine of the scapula, and then the medial border comes to the inferior angle. So this will be the infraspinatus, and then the teres minor and teres major will be on that lateral inferior border. So if the patient has perceived tightness or pain in this area, then what we can do in terms of treatment is we can start off in this position where the muscles in the short position, and then get your patient to reach forward as far as they comfortably can. And then you as the therapist can lock in with one thumb placed on the opposite thumb, and then lock into the relatively taut tissue, and then slowly ask your patient to reach forward, and then you can literally fix where my thumb is pressing and ease off, lock in again and slowly reach forward so my thumbs are relatively fixed like so, and ease off. And if I want to come round to the teres minor, okay, come round onto that axillary border, lock in and then slowly reach forward. Okay, and then ease off. As the patient eases off, lock in, and off you go again and reach forward. And that is just a fixating of the tissue as he's reaching forward. You can actually use a slide-in technique, so you can use 3 fingers. So find the medial border. So from this area, you can lock into the tissue. When you're ready, please bend, reach forward, and nice and slowly you can reach forwards, like so, and then ease off, and I'm halfway through. And off you go again, nice and slow, and I can reach through like so. I can also come from this area towards the greater tubercle, and I can also work from the greater tubercle towards the medial border as well. So let's do a similar technique. Come lying on your left side. So from this position, what we can do is mobilize the shoulder going forwards into flexion, and mobilize the shoulder into abduction. You can use the fingers on the greater tubercle and encourage the glide posteriorly and the glide inferiorly as you lift the shoulder in a plane of motion. You can do an MET from this position. Push your arm down onto your hip for 10 seconds. And after 10 seconds, take a breath in. And as you breathe out, we can then encourage further abduction, which will help with impingement, and you can do that 2 or 3 times. You can also, from this position, we can start just below 90. So if you hold your arm in that position with your thumb facing out, so it takes away impingement, lock underneath the medial border of the scapula and on the top part, and then from there, when you're ready, slowly bring your arm over your head, and then you can rotate the scapula and then bring it back around, bring your arm down towards your waist, like so, and then off you go again. So bring your arm over your head. So I'll be a mobilization from an MET. Okay. We can also, as his arm is going forward and backwards, bring your hand under the axilla onto the area where you feel there is restrictions, like there's a little tender point in that area. You can do a trigger point release first if you want to. Lock into that tenderness and then slowly reach forward. And you notice my thumbs, I'm locking in, but I'm slightly bringing my thumb towards the medial border. So watch again, reach forward, and I can bring my thumbs down towards the medial border, like so, and as he's reaching forward. Once more, I can lock in, and then reach forward, like so. Okay, have a lie in your front. So from this angle, the arm is hanging, and then you've got the same musculature around the shoulder, and you've also got this area around the lower fibers of the trapezius and the rhomboid. What we can do this time is I control the movement this time, so it's more passive. My fingertips onto the area of the infra into the teres, and I can just glide through those tissues like so. Coming round off the border onto the lower trapezius through the rhomboid area, like so. And I can mobilise the scapula and lengthen the tissue as I'm coming through. You can also utilise the supraspinatus, find the supraspinous fossa, and then you can use 2 fingers into the fossa, and then from this position, as I lock in, I can then take his arm into adduction and lengthen through the supraspinatus. Again, lengthen through as I bring his arm down into there. A nice little technique you can do for the shoulder is to bring the arm through the leg, cradle the shoulder like this, and then what we can do is glide the shoulder in its planes. Okay, so you can encourage it anteriorly and posteriorly. We can also circumduct in both planes, and we can also use a glide. I can lock in and I can glide the humerus inferiorly, and I can glide the humerus superiorly.